Hi everyone, I'm Dr. Ann Pendo, and I am the Senior Medical Director for Experience of Caring at Intermountain Healthcare, and I am pleased today to speak with Dr. Dixie Harris, who practices pulmonary and critical care medicine at Intermountain Healthcare. And on this month of September, which is Women in Medicine Month, I am pleased that we will get an opportunity to spend some time together talking about your work and really work through COVID. So thanks for being here today.
Sure, thank you for having me.
So you practice pulmonary critical care, and I know that we have shared patients and worked together in various different ways. And your life and work was focused in pulmonary and critical care medicine before COVID arrived. But then once it arrived, things changed. Can you tell us a little bit about that?
Yes, so most of my world is in the clinic, and clinic really slowed down, and we rapidly learned how to do e-visits in every different way. First, we're doing telephone visits, and when it was coming, the end of March, we knew, you could see it coming. Most pulmonologists have been watching it since easily January because of MERS and SARS-1. So we knew this was coming. So kind of getting my patients in, like, we got to get in now because I don't know when I can see you again. And then doing telephone visits and then doing e-visits, which has been an experience. I've now done an e-visit in Alaska. I've done e-visits, and patients are in different areas of the country and the world, kind of trapped. And many of my patients have been actually been caught by the epidemic. So it's been a different experience. And we've been, what I would kind of say, kind of the mantra is to be very plastic, very malleable, and being willing to change on a dime.
Yeah, and I, as you're sharing that, I'm thinking of one of the things that I've most admired about you is your ability to see a problem and fix it and say yes. You went to New York. You're now working to better understand the long-term side effects of COVID. What is it that allows you to recognize and then act rather than waiting for someone else?
So I think part of it is maybe it's not necessarily me coming up with the question first, but listening to the question and then moving the question forward or putting the pieces together. We did that with eValley, where we saw 5 different patients at 5 different hospitals and then realized, oh my goodness, there was this whole vaping thing that happened. And then with, like, for example, the COVID long haulers or post-acute COVID or long COVID, there's still not a true name for it and not a true definition. But I was seeing patients, and then I was actually asked a question by a reporter who said, would you be willing to make a comment about it? Have you seen patients with prolonged symptoms? And then I went back and like, oh yes, I have this patient. And then I subsequently have identified several patients like in arrears that I had run into in May and June that have been having symptoms. So some of it is kind of putting it together and then being willing to just learn so much as much as you possibly can about a subject. And that's the one interesting thing about the virus is the fact that almost everybody I know in medicine has rejuvenated all their basic science. They've gone back in and learned virology. They're reading. I just spent the weekend with a friend of mine who's an interventional radiologist, and she can tell you all kinds of things about vaccines because she's just reading, and we're very interested. Again, we're trying to stay in the data, not in the data-free zone, but really trying to understand what's happening in our world and what this virus is doing, and the good things and the bad things that the virus is doing.
So you were one of the first groups that went to New York to care for patients. Tell us a little bit about what that was like for you.
So we were so fortunate to have the ability to send people. Part of it is Utah did not get hit as hard as other places. So we had the care providers freed up. So, we went there, we got on the ground, and then just started running. We went into a place that looked like it had been completely devastated. I've patients everywhere. I've worked in several inner city hospitals. I've worked in Atlanta, I've worked in Baltimore. So I know kind of what it's like to work in a situation where you don't have enough resources, staff, and more patients than you can ever handle. But this was way beyond what I ever saw. It was an interesting, fascinating, and in truth, sad situation. But really watching the resiliency of the providers, and these are all people taking care of their neighbors, their own family, and people just stepped up and were tough.
So it was really personal for them. And it sounds like your listen and learn philosophy while you were there allowed you to come back to Salt Lake and share what you learned and allow us to implement. We worked together on the visitor policies and recognizing, I think, your voice in bringing to the forefront what it was like for patients and families, and how we can do better for them. And I think your experience in New York really gave us that front row or firsthand experience.
Firsthand experience of really what it's like caring for somebody for days and weeks. There were many patients I took care of for the entire time I was there in the ICU. And we're trying to call the family on the phone, but it's really hard. Even if you have FaceTime, it's really hard to convey all of everything that needs to be conveyed without being in person. So, I really credit Intermountain for going ahead and opening up some visitors policy. I just did ICU rotation this past weekend, and it was night and day, able to have family members with us. Still very restricted in just the COVID ICU, but the other ICUs we were able to have families, and really able to make some meaningful connections and help people through their illness journey, whether they're going to survive or not, and help the families go through it too.
Yeah, that's so important. So with all of your really emotional work and caring, how do you take care of yourself?
Number one, I try to enjoy myself. I try to laugh. I try to find things to be very positive about. And I'm going to share with you something I took up, which is I'm doing paint by number, because I don't want to do any kind of painting that will stress me out because I can't make the tree look exactly like a tree. So I'm doing this really Zen-like, adult level paint by number, and it's been very relaxing. I'm trying to find activities that are not too stressful but can let my mind go in a different space. I'm doing some exercises. I'm spending a lot of time outside. I'm enjoying nature and enjoying the healing components of nature.
Yeah, that's great. So in our last bit together, anything you want to share with the audience about what you've learned during this time, either about yourself or yourself as a leader?
I think the biggest thing I've learned is we need to be as flexible and plastic as possible. I've used that word before. And be willing to collaborate in all fashions. We've collaborated on the ICU visitation committee. Next thing you know, we're collaborating on the long haulers, and just learning how to work together and learn quickly how to work with a group that you've never worked before. So plastic and collaboration are my two key things.
Great. I love it. I love it. Thank you so much for joining me today.
Thank you.
We'll look forward to learning more about what you learn in the months to come. Thanks everyone for joining us today on Leadership at the Forefront of COVID. See you next time.